Welcome to the Screening, Referral, and Assessment episode of the West Virginia Expanded School Mental Health Framework Series. In this video, we will discuss school mental health screening, referral, and assessment. We will define each component within the context of the ESMH model, highlight best practices, and provide examples and resources to support implementation. The WV ESMH mini-webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare for implementation. This video is part of that series. I'm Crystal Criswell, School Mental Health Coordinator from the Marshall University School Health Technical Assistance Center in the Division of Community Health within the School of Medicine. This video series is presented by our office with funding from the West Virginia Department of Human Services Bureau for Behavioral Health. Our learning objectives are to increase the understanding of effective implementation of screening, referral, and assessment in schools, and to provide relevant resources. Let's do a quick review of the ESMH framework. What is expanded school mental health? ESMH is a collaborative, multi-tiered framework where schools, families, and community partners work together to improve student mental health supports. ESMH is designed to support all students in developing skills that support healthy coping and emotional wellness. ESMH addresses the critical link between academic success and mental health. It is planned and proactive rather than reactionary in nature. The framework is strengths-based and flexible, using data to build upon what is working in each school. This video will focus on the use of mental health screening, referral, and assessment in expanded school mental health. Some may be a little confused about the difference between screening and assessment and how referrals fit in the process. Think of it this way. Screenings are broad tools used to identify potential concerns across groups of students. Assessments provide in-depth evaluations for individual students. And finally, referrals serve as bridges connecting students to the appropriate level of support or services. The purpose of screening is early identification of students at risk for mental health challenges by evaluating their strengths and needs. Based on the results, students are referred to appropriate interventions and support. Universal screening is the systematic assessment of all children within a given classroom, grade level, or school building for social, emotional, and behavioral indicators that can impact student success and well-being. Indicators may include school belonging, behavior, anxiety, depression, bullying, substance use, or social determinants. Screening formats may include questionnaires, behavioral checklists, client interviews, and observation. They may be self-report, parent and school report, or clinician administered. We recommend following these best practice steps to implement screening. Designate a school or district level staff person to coordinate screening and implementation. Convene a team to plan a screening program that includes community mental health providers, school staff, parents, and student representatives. Review and select age-appropriate screening measures based on evidence, feasibility, affordability, and acceptance. Determine the scope and frequency of the screening. You may choose all students, certain grades or classrooms, new students, students with other risk factors, or students using health center services. Determine which community providers to use for screening and referrals and have written agreements defining roles and expectations. Establish protocols and policies for informing parents, obtaining consent, responding to students at risk, follow-up, and coordination with community mental health providers. Based on SBIRT and MindWise signs of suicide research, schools should expect that 5 to 10% of students will require follow-up. Promote buy-in through parent and staff information and gatekeeper training for all school personnel, parents, and community. Have trained mental health professionals at the school on the screening days to address immediate needs. Some examples of screening tools recommended for use in West Virginia ESMH include the MindWise Signs of Suicide Program's brief self-scored depression questionnaire that encourages students to reflect on signs of depression or suicide risk they may be experiencing and to consider resources available for help. The CRAFT is a well-validated substance use screening tool for adolescents aged 12 to 21. The Strengths and Difficulties questionnaire is a brief behavioral screening questionnaire for ages 2 to 17. The Patient Health Questionnaire and Generalized Anxiety Disorder 7 are concise, self-administered screening tools for use by primary care providers, school-based health centers, and trained clinical or non-clinical staff. In addition, the National Center for School Mental Health's SHAPE system includes a screening and assessment library with 35 screening and assessment tools appropriate for use in school settings. The primary purpose of the referral process is to connect students who are at risk with needed services and support. Students showing early warning signs or mild symptoms can benefit from early intervention programs in Tier 2. However, about 5% of students will require intensive services at the Tier 3 level. Both tiers require a referral. To establish an effective referral process, school-level ESMH leadership teams create a comprehensive written protocol that outlines each step clearly. This protocol must define staff roles and responsibilities, include procedures for tracking referrals, parent notification, and expected timelines for student follow-up. All personnel should be trained to initiate and manage referrals, whether prompted by screening results, concerns about a student's behavior, or self-referral. Staff members responsible for overseeing referrals may need specialized training to ensure the process runs smoothly and consistently. The following steps should be followed in the referral process. Review the data from screening initiatives in a timely manner. When performing depression or suicide risk screening, it is best to review them the same day. In most cases, it is acceptable to respond within 24 hours, but be prepared to respond immediately to students who demonstrate urgent or high-risk needs. Schedule a consultation with the student and, if appropriate, their guardian to explore needs and available support options. This typically involves completing consent for release of information forms. Facilitate linkage with providers of Tier 2 or Tier 3 support to confirm referrals, discuss service availability, and help ensure a seamless entry into services. It is important to clearly convey that Tier 3 referrals are for clinical mental health services. Provide clear instructions to students and families with up-to-date contact information for providers. Organizations generally provide their own referral forms available either online or in paper format. The design and content of these forms vary based on the level of intervention and the specific requirements of each organization. Examples include forms for school-based interventions, early intervention services offered by community partners, and referrals for mental health treatment. All referrals require basic information such as the student's full name, grade level, details about the issue for which the student is being referred, the level of urgency for follow-up, and the name and contact information of the referral source. An assessment is a structured, in-depth evaluation of a student's emotional, behavioral, or psychological concerns completed by trained clinicians. The purpose of an assessment is to determine specific needs and Tier 3 mental health treatment strategies. Clinicians use standardized assessment tools, psychosocial histories, and other data to identify existing issues and develop an appropriate intervention plan. Most mental health agencies use specific assessment and treatment planning forms that are tailored to their electronic health record or billing software. Key considerations when performing assessments in schools for Tier 3 services include: protect student privacy using HIPAA and FERPA compliant systems to secure student health data during the screening and assessment process. The Family Educational Rights and Privacy Act and Health Insurance Portability and Accountability Act are federal laws. FERPA and HIPAA regulate privacy and the exchange of specific types of information. The work of healthcare providers, school personnel, and others often intersects with FERPA and HIPAA. Provide clear information to students and families about their right to consent to or decline treatment and obligation to pay for services if applicable. Provide a timely response to the individual who made the referral, thanking them and sharing a brief status update. Follow up within 3 business days and continue checking in every 7 business days on any pending referral until resolution. Do not share detailed client information unless necessary for treatment and the guardian has signed a release of information specifying what can and cannot be disclosed. Here are some examples of assessments. The Child Behavior Checklist collects information from educators or parents regarding children's emotional and behavioral functioning in a variety of areas, including social withdrawal, aggression, and anxiety. The Beck Depression Inventory is a 21-question inventory for assessing the severity of depression symptoms over the past week. The Mental Health Status Examination is an in-depth structured assessment that evaluates a patient's appearance, behavior, speech, mood, thought process, perception, cognition, and insight. The Minnesota Multiphasic Personality Inventory, or MMPI-2, is a comprehensive psychological test used by clinicians to assess mental health, diagnose personality disorders, and inform treatment plans. It consists of true-false questions and evaluates aspects like anxiety, depression, and personality disorders, with the MMPI-2 being a widely used and updated version of the original test. There are also state-required Medicaid assessments, often known as the Care Connection Form. You can find links to the following resources in the video description below: the SHAPE System Assessment Library, the American Psychiatric Association's Online Assessment Measures Database, the National Institute on Drug Abuse Screening and Assessment Tools Chart, and the Centers for Disease Control and Prevention, who offer a 1-page infographic on navigating the intersection of protected school and health information. When expanded school mental health programs implement a strong screening, referral, and assessment process, students with mental health needs are identified early and can access appropriate interventions quickly. Early intervention helps reduce the need for intensive treatment. When therapy is necessary, timely diagnosis and treatment are essential to improve long-term outcomes, prevent conditions from worsening, and minimize secondary complications. Addressing mental health concerns early also lowers healthcare costs and is critical, as many issues first emerge during adolescence. The West Virginia ESMH website has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites as well as upcoming trainings. We encourage you to check out all of our videos on the Marshall University's School Health Technical Assistance Center's YouTube channel. Thanks for joining us for the screening, referral, and assessment video of the West Virginia Expanded School Mental Health Framework.